Hello and welcome to our show. I am your host, Xiao Yifan. We've all had the experience of going to see the dentist for cases such as cavities to a fractured tooth. Usually, all the dentist has to do is patch the tooth up to restore its function. But if the tooth is damaged beyond repair, then false dentures are needed. Now, if you think that to have false dentures you need to damage the adjacent healthy teeth, then it is too uninformed an opinion, and it will be a detriment to your health. For today's show, we welcome a dentist with 30 years of experience from Huatai Dental Clinic, dentist Lin Tai Wu. We welcome Dr. Lin to the stage. Hello, doctor. Hello, audience. We'd like to now have Dr. Lin explain the correct way to save teeth. Most people believe once we have false dentures, cavities will never plague us again. So people eat copious amounts of whatever they want, especially stick foods, without minding their teeth hygiene. When putting on false dentures, people should have a concept that this isn't one and done. If teeth are not properly taken care of, one can still get cavities or periodontal disease. It can even cause the destruction of the false dentures, and they may fall off and come undone. Even for people without cavities in their mouth, there is difficulty in cleaning all the nooks and crevices in the mouth. For people with fixed dentures, it is even more difficult to do a thorough cleaning. So today we are going to learn how to prevent the development of germs in our mouth, causing situations such as bad breath, which can also be embarrassing to people. So you're going to tell us how to take care of our teeth, whether they are regular teeth or false dentures. Okay, the question will first be answered in a regular scenario to the degree I have studied it. Firstly, the teeth that we naturally have are just not easily cleaned. Yes. Lots of gaps and crevices, using a small brush. Fixed dentures designed by the medical schools are also applied begrudgingly because of the problem with material. So on the cleaning of the teeth, it is very difficult as they are crevices created by fixed objects. These crevices between the teeth can't be cleaned thoroughly. So how do we clean these crevices thoroughly? The most important thing is to use the variety of tools we now have at our disposal. We can use ultrasonic toothbrush as it is more convenient than traditional toothbrushes. That really is better. Really should buy it for the sake of your teeth. During brushing, on the angle of brushing, it doesn't require large movements. All it needs is small gentle movements. Another tool is the interdental brush. Young people may not be able to thread the interdental brush through the gap between the teeth, but older people, 40 to 50 years old, need to use it since their gaps will be wider. So it is small with little bristles on it. This way we can clean the four sides of the tooth. Usually normal brushes only clean the outer two faces of the teeth. Only with the addition of the interdental brush can the tooth crevice be cleaned thoroughly. Younger people need a water flosser and a regular dental floss as they may not be able to reach the teeth cracks. So cleaning is the first step to protecting the teeth. Correct. And the initial ailments relating to teeth are usually periodontal disease. So cleaning the teeth properly can prevent periodontal disease. Yes, it's a hygiene issue. Another newer method is for older people when they are alone to suck on their teeth, allowing the dentist to trim the gums lower, just like cutting the nails, so it is easier to clean. That's scary. When one is alone, to suck on their teeth using the vacuum created in the mouth from sucking in, using this method to remove the food debris and filth. It is a new method. It may sound really backwards, but it is a very useful and practical method. There are a lot of crevices an interdental brush can't reach. The areas beneath the gum can't be reached with a brush. You've brought a lot of molds and models of teeth today. Are you going to explain them to us? There are fixed prostheses and many methods for installing them, but some of them have the flaw of not being able to be cleaned. How are we to address it? People tend to think that because they are false dentures, there isn't any maintenance to be done as they are false teeth and won't corrode. This is an erroneous assumption, correct? Yes, fixed dentures prostheses are even harder to clean than natural teeth. For shorter and flatter teeth, which is more common among Asians with shorter chins, it is difficult to find a gap that an interdental brush could pass through. Sometimes even water flossers can't rinse through it. Fixed prostheses are harder to clean than natural teeth. This is why I invented a removable prosthesis which can be taken off. Can you demonstrate what you mean? Under what circumstances? With a fixed prosthesis, an inner dental brush can't pass through a lot of the time. Now the dentist will say to come in every half a year for a tooth cleaning. Some of the times even thin pointy dentist tools can't pierce through. Now if we can remove the tooth, the pointy end of a tool may vertically reach the gap between the gums and the teeth to truly complete a proper cleaning. The teeth cleaning that is conducted nowadays is a cleaning that can't guarantee perfect cleanliness, very painful and full of blood. Periodontists have a lot of tools, but the problem is the size of the crevice they are dealing with. They use different angles to try and get at the filthy part which really can't be reached. As long as you are able to remove the tooth, the area can be cleaned. Pick it up and it can be cleaned thoroughly. I see that with your false prosthesis seem to be in pairs of teeth. Now with this removable prosthesis, if one can remove it and clean the area properly, would the logical conclusion be to have the entire front row of teeth be removable dentures? What is the difference? In theory, once a person reaches 40 to 50 years old, a person should have removable prosthesis. And you are referring to the whole gambit with inner and removable outer crowns. Removable to maintain proper hygiene. Because making these prostheses are a pain and takes a lot of time and money, this ideal is not achievable. That is why we must use toothbrushes, water floss, inner dental brushes, and the sucking of the teeth with the mouth. Once we remove this prosthesis, every crevice and gap between the teeth becomes easily accessible for cleaning. Dentists can even use their water floss vertically to wash it truly clean. Despite going to the dentist every year for cleaning, the cleaning done by dentists still leaves out the really small, deep pockets where furcation can form. Correct, there's no way to change that. The first point in making a dental prosthesis is to have one where it can be removed for proper cleaning to be conducted. The second point is that teeth fracture. For example, this tooth right here. So the teeth don't necessarily completely snap off. They could just have half of the tooth fracture. This tooth here is the problem tooth of a young person. Getting drunk and fighting someone. If he has a severe cavity that requires a root canal, in our traditional method, we will just cap the problem tooth. To put a cap over it means you can't wash it clean. Not being able to clean the roots where it meets the gums means that, according to my experience, 7 to 9 years later, not only are your own teeth decaying, the tooth roots will also decay along with those of the adjacent teeth. This is where the saying of fix one tooth to destroy three comes from. So having the prosthesis be removable is of utmost importance. Furthermore, another reason for extracting teeth after application of a fixed prosthesis is the tooth fracturing. There are too many people who, after a decade, with or without root canal, fracture their teeth, causing a swollen pocket to form. The current dental practice of fixed prosthesis can only restore the outside appearance of teeth. But a false tooth that has been root canaled and prepped, then just covered up with an outer crown, is still essentially a decayed tooth. The tooth has only been restored to its previous appearance and function. The hygiene hasn't changed, and it is even worse than natural teeth. Chewing torque is also not distributed evenly. A decayed tooth withstanding the same force will fracture after a decade or so. So pertaining to this issue, removing the outer crown, we can clean it properly. This inner crown we have prepped to have more slanted sides instead of being vertical. In the past, dentists were taught to make the sides of the inner crown as vertical as possible to prevent it falling off, but now we are purposefully making it with slanted sides so we may remove it after 6 to 7 years. It's just like checking the hood of a car. We can patch the tooth up and then glue the inner crown back on for further use. Decaying of the natural tooth won't occur. Another issue is the one of fractures. For the problem of fractures, we create rest arms on both ends extending onto the adjacent teeth to distribute the bite force. This will prevent fractures. The torque that the tooth must withstand is only around 1/3 of what would have. A fracture is not possible because on the rest arms, we have U-shaped rest arms on the adjacent healthy teeth. Now for a young person, this tooth can be used for the rest of their life. At worst, after 30 to 40 years in my experience, if the adjacent teeth have some decay, at most we add another tooth to the removable prosthesis and make an inner and outer crown. Now the new inner and outer crown as well as the old one can be fused together. So we don't even need to remake the old prosthesis, only the addition of the new one. The addition of another tooth 30 to 40 years later to the prosthesis is not a problem at all. Doctors who care for the prosthesis, meanwhile, just need to ensure the stability of the base tooth. If there is decay, only little tweaks are needed. This is a very feasible thing. If we can use it, we will continue doing so to avoid invasive procedures. Nearing the end of a person's life, when they are in a nursing home, in a wheelchair, or bedridden, the nurse may still remove the prosthesis to help them. If a dentist needs to operate on the patient or perform a tooth extraction while they are in the sick bed, it is very convenient. To extract a regular fixed prosthesis tooth, the tooth has to be filed down and cut open like a longan. It's a small, hard tropical fruit. This is a hassle and can't be done. Going to a sick bed, a mentally handicapped individual just has to take off the prosthesis. And upon the doctor finishing whatever treatment it is, replace the prosthesis and they can resume eating immediately. If there are many supports, removing a single support won't affect the integrity. So this kind of invention is very caring. The invention takes into account youth all the way to people of old age. So he has already solved the problems of fixed prosthesis with the removable prosthesis. Yes, tension retaining prosthesis. In our next segment, we will continue discussing news we had 2 days ago about someone getting prosthesis and being caused so much pain that they jumped off a building and committed suicide. Why is there even such a painful case occurring? Nowadays, people get tooth extractions for no reason. This is a huge lack of responsibility. Now, what sort of new alternatives are there? We will discuss in our next segment. Now we have from the Watai Dental Clinic, Dr. Lin Tai Wu. He's going to tell us some important information about getting dental prosthesis. Indeed, in the last couple days, there was news about an elderly lady who had dental prosthesis installed for 3 to 4 years. The pain caused by the dentures was too much and she jumped off a building and committed suicide. This isn't an exaggeration. Now we are going to ask a dentist how there can be such pain caused by dental prosthesis. They say it is because lots of people get their nerves and pulp removed in root canals when they feel tooth pain. Root canals are covered by insurance, so dentists don't make much money from the procedure. That is why dentists will tell patients without hesitation to just extract the tooth and get implants. In truth, does every bad tooth need to be extracted? We heard from Dr. Lin Tai Wu earlier that some teeth only have minor wear. Is there really a need to extract and behave so violently towards your own precious teeth? And even get an extraction? It isn't necessarily the right choice for everyone. So this lady, you have seen the news about her too. Why would her teeth pain her so much as to motivate her to suicide? She went to complain to her dentist, but the case had no conclusion as the lady in question is deceased because of her teeth hurting so much as to make her consider death. This occurred because in the past prior to my invention, the predominant prosthesis was the fixed prosthesis. But upon getting fixed prosthesis, it is difficult to solve any problem that occurs. That is why I invented the tension-retaining removable prosthesis. The removable prosthesis allows for good hygiene. In the past, because of fixed prosthesis, people couldn't clean their teeth thoroughly. Problems such as inflammation and pain have all been solved. So far, I have categorized of the kinds of teeth that don't need to be extracted into 4 types. Yes, the big 4. In the case that your dentist tells you to extract your tooth and it falls into one of these 4 categories, you should come see Dr. Lin Tai Wu and get a second opinion. It is impossible for me to see that many patients. The important thing is that dental schools hurriedly change their curriculum. Do the right thing and not just care about making a profit, to think of people's well-being. Progress needs innovation and breakthroughs. Correct. Number 1, until recently, all the dentists, including those from Germany, US, and around the world, certainly almost all those in the world, operated on the notion that as long as there's this bifurcation where the roots of the teeth bifurcate, because we haven't cleaned the area properly while we were younger, so the bone, whereas before it was full, it has decayed, creating a furcation pit. This is essentially the cesspool of the mouth. When food debris enters, the gums are here floating, slightly inflamed, and the food goes in. First 2 days it is food, the second day it is more akin to sewage waste, and on the 5th, 6th day it causes an unbearable stench. Yes, 30 minutes after brushing your teeth, it starts stinking again. So this bifurcation pit causes a path of destruction. During the process of decay, it will also affect the heart as well as other vital organs. So cardiologists also advocate extractions to protect the rest of the body. Now periodontists will say they can't clean this properly. The patient can't clean it properly either, therefore we should extract the tooth. Then why do you say not to extract the tooth? The problem lies in not being able to clean the tooth. Periodontists are unable to clean it, and nor can the patients. But the problem is we absolutely have to keep it clean. We have to create and design an environment that can be kept clean. So if there is this furcation pit below the tooth, we will have it root canaled and bifurcated. Cut it in half, especially if the bone still has 2/3 its original height. At this height, this tooth is still very strong. After cutting it in half, we can fit on an inner crown. It is thus turned into two separate independent root structures, just like this. So there's no need to extract the whole tooth. In the past we had to extract it, now we don't have to, just like this. So this method of treatment is also cheaper, correct? Originally, the furcation pit is inside the bone. It is very hard to clean. Even dental professionals don't have the means to clean it thoroughly. Dr. Lin, doing it like this costs a lot more labor. Are other dentists willing to do this? For the sake of responsibility, a dentist should do the right thing and learn this, especially for their own family and kin, if we speak frankly. Learning these techniques isn't very hard. This solves the first problem that leads to extractions. The furcation area and the bifurcation area already don't have to be extracted as long as there are healthy adjacent teeth. What is the second type of tooth that shouldn't be extracted? The second type is a fractured tooth. Usually fractured teeth are said to be extracted. There is currently a case where a patient came the day before a checkup. The other doctor, my first protege, Dr. Xie, saw it. It is completely clean here. The clean part is akin to clean nails. This little bit of blood here is from me injecting anesthesia. Dr. Xie saw it. What is the problem with this tooth? It has a severe fracture, just like a snapped bamboo stick. A tooth with a fracture like that must be extracted. But while I was treating the patient, this piece over here was wobbling. This piece is relatively stable, so I save it. I don't need it to withstand bite torque. The torque is to be absorbed by the healthy, stable tooth in front. I'll salvage this piece to use for a casting ball and rubber cap tension retaining prosthesis. This section over here is used to retain the outer crown. The patient did not want an extraction. Whether or not an extraction is performed may be discussed between the dentist and patient. If the tooth is extracted, this tooth over here will be able to withstand more torque. If it isn't, it will experience more torque. The patient wasn't willing to undergo an extraction and said they'd rather compromise and eat softer food. Eating food such as chicken and peanuts are enough. Anything too hard they'd rather avoid. It has been a year and 4 months since the prosthesis. The patient came for a checkup, and as you can see here, the clean area is devoid of blood. This is a severe case. Natural teeth should be preserved. If the tooth can be of help, it should be salvaged. But you must have lots of patience. Yes, because it is taking 4 to 6 times more time to take care of the issue and only earning 1/4 of the amount. Yes, but it's a different sort of joy in this work. The most common case is one such as this. Within half a year, there can be 5 or so such cases with fractures. What is this called? The small molar, fractured molars. Too many. There are too many of these cases. A single doctor will likely encounter 7 to 8 of these cases in a year. Now that we saved this part, this fractured part, even if it's a deeper fracture, can be salvaged. As long as the fracture isn't too deep. As long as a tension retaining prosthesis is made and the tooth is cleaned, the surrounding areas are unlikely to become inflamed. In the past, when they wanted to extract teeth, it was because prostheses were fixed, causing this part to become inflamed. And once a tooth is fractured, merely filing it down and capping it with a crown only increases its chances. But the problem of hygiene, tension-retaining prostheses may be removed. The adjacent sides with the rest arms are able to absorb the torque from chewing. Leaving this tooth in the mouth, its bone around the tooth roots helps retain the structure for a beautiful smile. Extracting a tooth will leave an indent. Any smile with an indent will always look odd, so retaining natural teeth is very important. Just like a removable prosthesis. The incisors have the adjacent rest arms bear the brunt of the torque. The teeth won't fracture. it can be cleaned properly and won't decay anymore. When it comes to the treatment of teeth, there are two main criterion. Number one, total hygiene. This includes the cleanliness of the area inside the inner crown and preventing decay there. Number two, the tooth beds and the surrounding bone area don't decay. Number three, how to withstand chewing torque, using adjacent healthy teeth to withstand it. Only when there isn't any adjacent healthy teeth should extraction be considered. Okay, now the fourth type of tooth that should not be extracted. The fourth type shouldn't be extracted, despite most of the world saying so, are wisdom teeth. Yeah, almost everyone says this. Result, this is the case. This is a wisdom tooth growing and pushing forwards. Dentists around the world will say without hesitation that this tooth must be extracted. But the problem is this tooth doesn't have enough stability. The entire mouth must be redone. There isn't enough stability. This wisdom tooth had some minor decay. In the beginning it was very filthy, but I taught the patient how to clean it properly. Now there are hypersonic toothbrushes. This can be cleaned thoroughly when paired with an interdental brush. A doctor is a person who is very good at thinking and creating happy products. Over here, we made a tension retaining prosthesis, a metal T-plate. Inside this tooth is a clip that will allow it to be retained. Maintaining good hygiene isn't a problem. This is still considered a good tooth because there is still tooth above it. So over here, we make a tooth so they can oppose one another. Connected together, food debris won't be getting mashed into the cracks. Hygiene is controlled and adequate stability is there. Leave this here. In this case, there is a lack of stability for the tooth. Of course, this other tooth here is needed to help bear some of the chewing torque, so we lean this on here, have the pair matching, so they can aid each other. Able to withstand torque, allow for chewing, prevent food from getting stuck in crevices, hygiene controlled, won't have periodontal disease. Of course, we will salvage this tooth and keep it. This has created for the patient an alternative to getting an extraction. It truly helps prevent periodontal disease. If the patient has periodontal disease and inflammation, all the dentist has to do is remove the prosthesis, apply anesthesia, and wash the area clean. It will be healed after 4 to 5 days. Many dentists, in the pursuit of earning more money while minimizing their hassle, will just extract teeth. Dr. Lin has separated the tooth in two pieces, on this side fitting on with a retainer, and on this side applying a tension retaining removable prosthesis. We think, wow, it is such a hassle despite the dentist saying it is joyous. So we have seen on Dr. Lin Tai Wu why he is able to invent what other dentists the world over have been unable to invent. It is because Dr. Lin is dedicated and passionate about his work. That is why he sought to invent such a thing, to wholeheartedly save the teeth. Truly, this is an indictment on the dentistry world. I hope that all the dentists respect their work and care for all humans, and in the process earn some good karma. We thank you, Dr. Lin, for joining us today.